Let's get started.
There we go. This is exciting. Good morning, everyone. Thank you for joining us for our Midlife Elevation Summit. Sally, Lynae, and I have been working together for a couple of months, sharing ideas and trying to build this out as to what information are people needing from our algorithms. There seems to be an awful lot of perimenopause and menopause stuff, but we also know that that's our algorithms. And there are voids in the conversation. I see it with my patient practice. Certainly, it's come up with the friend group. We're all of an age and discussing ideas. So we're going to try to impart lots of knowledge that you guys can then take with you. Please put questions in the chat. I think Sally mentioned that. I have probably the most slides and probably the wordiest slides because you can take notes, by all means, please do. But I'm also fine if you just want to do like a quick screen grab or a screenshot so that you can listen and tune in, but also find me after for questions. So a little bit about me, if you don't know, I'm a fire dragon, year of the fire dragon. So if you know your Chinese zodiac astrology, that puts me at 48 2 years ago. So I'm going to be 50 this year. I've been more than 35 years in the natural health industry. I got a job as a young teen when I had all sorts of health issues. And then through working in a health food store and learning more as I went, I was able to relieve myself of a lot of health issues. And decided at 14, like, I'm going to be a naturopathic doctor because everyone needs to know about this stuff. Always learning. Some of that mandated by my college and some of that just because it's interesting and I want to do a deep dive. I'm very happy with my patients and I love working with them, but I am also very happy with my family. I've got two kids, 11 and 7. So if you're doing the math, I had my children later in life. So when hormone changes happen, I'm like, is it because I just had a baby or is this perimenopause? I'm not really sure. Love making good food. My first degree is in nutrition, so I'm happy in the kitchen without my family. Playing board games, and I love organizing and structuring and making sense of things. Disclaimer, I absolutely have to do this because I'm a licensed medical professional. If anything I say, you're like, ooh, she said that, so I should do it. No, this is just educational, informational. This is not direct medical advice. It's a bit of a joke in the naturopathic industry. If I have 10 perimenopausal women in front of me, they are probably going to walk away with 10 different treatment plans because what's their personal history? What's their family history? What else is going on with their body? What, symptoms are they experiencing? So it isn't just a carte blanche. You have this, you get that meeting of the prescription pad. It's not a replacement for personalized medical advice. Again, we are all unique. So check in with your family doctor, or as we may discuss, another qualified healthcare professional if you are struggling with getting your needs met. And what I share today, so really same thing said in 4 different ways to be super duper clear. Starting with the definitions, because again, working with women and patients, this often is like, there's some blurry lines here. Perimenopause is that period of time that is anywhere from estimated 4 to 14 years prior to your final menstrual cycle. So we don't really know. We don't have a great test. We don't have a strong understanding of when we're in perimenopause because we don't know when our final menses is going to be. We're guessing. We know it's going to happen probably somewhere in the 40s, early 40s or late 40s, dependent on that woman. Are they going to have the shorter one, the longer one? All these curiosities. But there are changes in hormone levels, which we'll be going through. FSH is follicular stimulating hormone. This is the hormone that when we are cycling in our reproductive years, spikes in the middle of the month, we release an egg, and then it drops back down and is dormant again for the next 28 days, and then it spikes again. So as we age, the amount of signal that the brain needs to send, the level of FSH that the brain is sending out to get an egg to release goes higher. And when you're young, it's just like, release an egg and boop, we're done. But as it goes, it's like, you gotta get that egg. It gets louder and the number gets bigger and bigger. So that's one thing we can measure. It can vary from month to month. Estrogen, a lot of hormone changes, a tough one to measure. I'll get into that more as we go. And progesterone also changes. Menopause is a date on a calendar. You have your final menstrual period. You don't know it's your last one, but you go 365 days, boom, that is your menopause date. If a woman doesn't have a uterus or if they've had uterine ablation and we don't have a menstrual cycle by which to assess, then we're going with symptoms. Maybe some labs, but again, the labs are highly unreliable. And postmenopause or being in menopause, we're arguing that these are probably like the best years of your life. Back in the day, 100 years ago, menopause was not a thing because the lifespan was about 50, 60 years old, and most women go through menopause at a roughly 50, 55. So there wasn't a lot of time postmenopausal. We are now in Canada, the health expectancy of women is 83, and the average age of menopause is 50 to 55. So we're looking at it 30 years, hopefully more. That's just the average of living in this particular state of being. And we want them to be not decades of steady decline. We want these to be, we're thriving. The kids are grown. My career is finally shining. Like, we want these to be the best times. Some of the key hormone changes that happen, your progesterone drops. So progesterone, for gestation, pregnancy, own hormone. So this is the one that when that egg is released, the tissue that's left behind starts putting out progesterone just in case that egg gets fertilized. We have that second half of our menstrual cycle. Oh, that egg didn't get fertilized. The progesterone levels drop, estrogen changes. We shed that menstrual lining and start again on the next month. When we're in our 20s, prime reproductive years, pretty much 12 menstrual cycles, 12 ovulations a year. 30s, early 30s, that should continue. Late 30s, we start seeing changes in fertility because maybe you're only ovulating 10 or 11 times that year. Maybe it's only 8 or 9 times. We can still have regular menstrual cycles without having that egg release, which is why fertility becomes harder as we age. So progesterone tends to drop first. With that comes symptoms such as mood changes or anxiety. And progesterone is a very calming hormone, so if we don't have enough of it, we can feel a little edgier. Sleep becomes worse, again, less calming. Bone changes, inflammation. Progesterone is a potent anti-inflammatory. Estrogen drops, and then it peaks, and then it drops. It's like a fireworks display. Sometimes it is blackness in the sky. There is nothing there. Sometimes it is blinding light. Sometimes there's just a few little things happening in the distance. Really irregular and erratic. The other analogy I like is that, we're releasing estrogen on a fairly rhythmic level throughout our lives. And as we get through midlife, perimenopause, it's like the end of a ketchup bottle or a mustard bottle. And you squeeze and, oh, nothing came out. And you squeeze and, uh-oh. And you squeeze again, like it's all over the plate. So it's really irregular and erratic. And there's where we get the symptoms of hot flashes and night sweats. Estrogen regulates the thermostat in our brain that modulates our temperature. Again, the changes in bone structure, mood, cognition, heart health, cholesterol levels. Estrogen makes us our tissue is very elastic and pliable. So when our estrogen drops, it's when we start getting more wrinkles. It is also the hormone, we're the childbearing gender. So that big stretch to let the baby's head through, and then we recoil. Estrogen is allowing for that elasticity and also allows that elasticity in our arteries. So when we have ample levels of estrogen, our blood pressure tends to be good. We tend to have better cardiovascular health. And post perimenopausal midlife menopause changes, things can become a little bit more stiff or crunchy. FSH increases. So again, it's that yelling. Here we can get changes in body composition. So more of that central obesity or that organ fat that we don't want. Cognition changes, increased cholesterol production in the liver. From a therapeutic standpoint, we can give progesterone, we can give estrogen. Currently, there's not much we can do for the rise of FSH and the changes that it brings, but the drug companies are working on it. They're looking at an FSH antagonist. Bear with me, I am not great at Canva. I spend my time reading articles instead. So here's my childlike rendition. There's my cursor. So as a child, we have some estrogen. My daughter has some. What makes her look like a little girl. But in the years to come, as we go through puberty, there we go. There's going to be a little bit surges, this awkward stage where the hormones are kind of going in flux. We see changes in mood. We see changes in skin, evolution of a body in shift, in stasis. Here in our reproductive years, vague representation. For every year, there should be 12 little bumps, and that's going on for decades upon decades. But it stays fairly steady, oscillates a little bit month to month. Then we hit perimenopause, and it is anyone's guess. It's a gong show. It could be higher than it's ever been in our lives. It can be low. It can be all over the place. And that's where measuring is not the best thing, because am I catching on an upswing? Are we catching on a downswing? We can, but I just can't trust those results so well. And then we get to perimenopause where we have this later stage and it's low again. Progesterone, same idea. It rises once we start menstruating and releasing eggs. Again, a lot of teenage girls, that's a wobbly thing. It's not a nice, consistent 28 days right off the bat. Reproductive years, hopefully, is nice and consistent. Perimenopause, it starts to drop first. Estrogen starts to drop later. And then menopause, again, we have those later lower levels. Common symptoms, I'm sure we know many of these, I'm going to breeze through them, but the irregular periods and bleed patterns. So maybe the period is shorter or longer. Maybe the bleed pattern is heavier or lighter. No rhyme or reason, but something has changed. This is different. It's not how it's been for the bulk of my life. Hot flashes and night sweats. Again, these are kind of the classic, the woman sticking her head in the freezer. It's like, oh, bet she's having a hot flash. Sleep changes, mood shifts of any form. There could be depression, anxiety, ennui. I just don't care anymore, like whatever. Cognitive changes. Brain fog is a really common complaint. My argument for a lot of these, apart from hot flashes maybe, is that it's not specific to midlife changes. There's a lot of things that can cause brain fog. Digestive imbalances can cause brain fog, nutrient level imbalances that are, the common targets of antidepressant meds or brain meds. So non-specific, but still it comes up. You're like, what is that word? How can I not think of it? Skin changes, again, we're losing that elasticity. There can be hair loss as well. The weight changes, the vaginal dryness, itching, and discomfort, because that tissue responds to estrogen. It tends to be, plump and moist and protective of our organs. And as that thins and dries out, there can be a lot more irritation. And that also makes us more susceptible to urinary tract infections. Some lesser known symptoms, they can still be pretty common. Joint pain and stiffness. Why am I achy? Frozen shoulder. This is not a symptom, but it's more common in women than men, and it's more common age 40 to 60 than any other age. So it shows up in peri and postmenopausal women fairly often, or more often than the other demographics. But certainly women in their 30s can get it, men can get it at any time. Changes in body odor or changes in your perception of other people's smells or body odors. There can be relationship issues there. Changes in your taste of sense or smell, in your blood pressure, again, the elasticity of the arteries. Cold flashes. Some women get the shivers rather than the heat. Swelling, digestion changes, the list goes on. Those are all uncomfortable and they are worth addressing so that we can live our lives and have a good quality of life. Because we are spending hopefully a good 3 decades, if not more, in the postmenopausal state, this is where my mind goes when I'm dealing with someone going through the perimenopausal changes. Like, hey, I want you to feel good right now, but I also want to make sure that in your 80s, you have good, strong bones so that you can maintain your independence. You can climb the stairs, you can play with your grandkids, good muscle and joint health, you can carry your own groceries, cardiovascular, metabolic health. A lot of women are concerned around breast cancer. We have 5 times greater likelihood of dying of heart disease. So we need to be more mindful of our cardiovascular and metabolic health. So looking at blood pressure, cholesterol, sugars, things that should be part of a routine physical exam. Long-term health consequences, heart disease, we don't want that. Belly fat, many women just don't want that. Mental health, brain fog, mood balance, dementia risk. We want connection, joy. We want to be part of a community. And if we're mentally becoming deficient and retreating into ourselves, we're going to lose that connection. And then that speeds the aging process dramatically. A little bit of the science. We have cholesterol. We eat it in our diet. We make it ourselves as animals. We use that to make a grandparent molecule called pregnenolone. Pregnenolone goes down one of 2 pathways. It can go down to the right, become DHEA. DHEA is then the starting molecule for making testosterone, of which we have some, and estrogen, of which we should have lots. It also goes down a different pathway to become progesterone. So again, that for-pregnancy hormone. And progesterone is the starting molecule for making cortisol. This is our stress hormone. If we are under chronic, unrelenting stress, we can deplete our progesterone levels to the point that we can also then backlog, suck all the pregnenolone this way, and end up with lower than usual estrogen, testosterone, DHEA. So we need to be mindful of stress management. The other hormone that we're looking at here is aldosterone. This is the one that maintains our blood pressure by holding in sodium and water. And if we are losing the sodium and water, that's when we might be getting up to pee several times a night. So, oh, maybe I need to be more, mindful of this whole hormone cascade. But I'm going to really kind of hammer home the stress piece as we go. Holistic health, we're looking at all the hormones, estrogen, progesterone, big players. Going to talk more about them as we go. But I really think we need to focus on adrenal health so that we are maintaining our progesterone levels throughout the decades. We are maintaining our estrogen levels. When I say imbalance, I'm also thinking these symptoms look a lot like perimenopause. We get changes. If we have high levels of cortisol or imbalanced cortisol, changes to our bone health. We have to stay alive in that moment. We are under stress. We're going to pull minerals out of our bone to do what we need to do so we can fight the bear and stay alive. But then that's going to damage our bones long term. Long term doesn't matter if you're about to get eaten by a bear. It can damage our heart. We can get those weight changes, mood, and an irregular temperature. Thyroid, the imbalances there that we see mimicking perimenopause symptoms can be the weight changes, the temperature fluctuations, mood, the aesthetics, our skin and hair, bone health and heart health. And then insulin, a very key player and one that more and more medical doctors are checking in the fasting state, giving us an early insight into what's happening with that person's metabolic health. Heart health, again, low estrogen is going to spur on our heart health. So we want to see how that's interplaying with the insulin, weight issues, inflammation, and bone health. Again, I'm a terrible drawer, but bear with me. This is like your classic cortisol curve. So it is lowest at night when we're sleeping. It rises while we sleep, gets us out of bed. We're following the black line here. Gets us out of bed, bright-eyed, bushy-tailed, ready to face the day. Let's do this thing. Naturally declines as we move through our day. Now we're sleepy. We sleep well, hopefully, and then it rises again, gets us out of bed. There was a study done, and it's very old. It's 1994 when it was published. So they took someone's blood every 15 to 20 minutes. And we see that it's, kind of follows that curve, but in a more specific way. The red line, it rises in the morning, but it also rises after eating lunch. It also rose again after that person ate dinner, goes down, should be flatlined overnight, but there's like these little blips that happen starting about 2, 3 a.m. And then it kind of wobbles up and gets us out of bed. So women, patients, men as well, coming in going, I wake up at 3 o'clock in the morning, 2, 3 o'clock in the morning, out of nowhere. I'm just bing, wide awake. We're looking at adrenal dysfunction there. And again, that can tie into perimenopause because of that progesterone cortisol connection. So that trouble sleeping we want to be mindful of. We need sleep. Gonads, estrogen relates to insulin. It helps to make us more insulin sensitive, which then protects us from diabetes. Perimenopause, postmenopause, we lose that estrogen levels. We are now more susceptible to blood sugar imbalances. It connects with the thyroid. They use the same carrier protein, the same Uber driver to move things around. So if we give one, we might be affecting levels in the other. And many women are on thyroid meds. Cortisol affects estrogen. The higher our cortisol levels, the more we can deplete estrogen. So kind of pushing us maybe into an earlier perimenopausal state. Adrenals and insulin, they both raise blood sugar. Like all of these have relationships. My point being, let's look just outside the estrogen, progesterone, which are important. Pyramid of intervention, how are we going to maximize this person's health and response to life and quality of life and how great they feel on a day-to-day basis? We have to look at diet and lifestyle and nutrients. So Lynae is going to take us through the diet and nutrients, what we should be focusing on now at this stage of our life, again, with that sort of long-term mind. Lifestyle encompasses a whole gamut of things. Exercise, huge. Sleep, huge. And Sally's taking on those pieces. Connection, community, finding new skills. Maybe we take up oil painting. Maybe it's time to learn a new language, do the crossword puzzles. What do we need to do in our daily life that helps us to remain strong and vital and vibrant? I'm going to focus more on here, on the herbs and the MHT, androgen menopause hormone therapy. Yes, we'll get into that. So 2002, a big study came out that said that hormone treatment was bad and dangerous and kills people. And there was an 80% drop in the amount of hormone prescriptions written almost overnight. So herbs became something that in my profession was like, well, we've got other things to lean on. We can do acupuncture, we can look at food, we can look at herbs, we can do all these other things while women are scared of using the hormones. And then the research has been reevaluated, new studies have come out. We are now more comfortable with hormones again, but with a bit of a shift than they were at in the 90s and before. So our herbal support options, the phytoestrogens. Phyto means plant. Oops, sorry. Estrogens is estrogens. So think of these as your hormone balancing herbs. Chase tree berry is the classic. I do this anything from a teenager with wobbly periods who's trying to, we're trying to establish some rhythm, women who are trying to conceive, perimenopause. It's just your carte blanche, wonderful women's regulating herb. Dong Quai is sort of the lead herb in traditional Chinese medicine. Black cohosh, great for perimenopausal symptoms, the hot flashes, the night sweats, also good for pain. Sage is really kind of very drying. So if you're very sweaty, that's you. If you tend to be dry in the best of times, sage is not your herb. There's also phytoestrogens found in foods. Flax seeds is a rich source, as are chia. Most legumes, including soy. Soy is the richest source. Also tends to be GMO, so we want to just navigate the soy world mindfully. And then resveratrol-rich foods. Resveratrol is a compound that's found in red grapes. So little aside, my neighbor down the hall, she's, I think, late 60s. She was saying how she went through menopause very early in her early 40s. She and her husband had no idea what was going on. night sweats, drenching the bed, goes to the doctor, who's like, no, this is perimenopause. Um, but hormones were taboo at that point. He's like, don't worry, you're going to take black cohosh, drink some red wine. I'm not recommending red wine. Feel free to do it if you want to, but that's not a recommendation. But these two things, and she just, have you heard of black cohosh? I sailed through it. Liver support, any hormone imbalance. Again, the first puberty when we're becoming women to now perimenopause, which I call the second puberty when we are shifting. I've got roses in the background here. Christiane Northrup, in her book, The Wisdom of Menopause, defines puberty as like that stage of like the rosebud just blossoming into a flower. And menopause is that time when that flower becomes a rose hip. Beautiful in a different way, useful in a different way. We have not lost our femininity. We are now just rose hips. So we need liver support as it's a key part of regulating all of our hormone imbalances. Nootropics is a fancy word for brain boosters. Rosemary could be an essential oil. Put in your food, maybe drink a tea. Ginkgo biloba, lion's mane is a medicinal mushroom. Bacopa is another herb. And you can find blends of these in health food stores. Sometimes they're a slam dunk. Sometimes they're 30% better, helpful, but they can be worth trying. And then stress management. So there's a number of herbs we can do, but again, it's also a lot of lifestyle factors. So what about the hormones? I should have brought this one in earlier. HRT is the original term, hormone replacement therapy. The original hormones, though, is World War II, was like, if we take the urine from pregnant horses, there's a lot of estrogen in that. And we can give that to women with hot flashes, and their hot flashes get better. So that was the birth of hormone replacement therapy, was giving horse estrogens to women, and it was helpful. But it was also a bit of a mixed bag, increased risk of endometrial cancer. We're finding more liver issues because it was taken orally. And there are some horse hormones that are unique to our body, and our body has to process them as a foreign agent. Bioidentical then became trendy because people are like, well, I want the hormones, but I want it to be exactly like what my body makes. You cannot patent something that is naturally occurring in nature. So now we see more bioidentical, and it's the delivery method that is patented. So we're seeing more of those available. The preferred term now is menopause hormone therapy. And I like it because we are treating women in menopause. We are not replacing what they're lacking. You are not deficient. Yes, your levels are changing, but we're not trying to put you back at those levels that were normal in your reproductive years. We have new change. We're just going through that second puberty. So this is the preferred term in 2026. And the really exciting news, as of March 1st in British Columbia, menopause hormone therapy, most of them are free. So the government is recognizing this is a huge issue for half the population, maybe a third of them are going through the change. We've got like a sixth of our population is uncomfortable and not excelling in their life the way they could if they had some of these hormones. So they've made it free as of 7 days ago. Love that. Okay. Progesterone, it can be calming, so we tend to dose it at night. It can also be sedating. So I have some women who are super groggy in the morning, and we have to play with the dosing and what we do there. It balances estrogen. I'll often start with progesterone because in a third of women, it can be enough to get rid of the hot flashes, and then quality of life is good. They're sleeping better. We're happy. If someone is going on an estrogen, and they have an intact uterus, they absolutely need to be on a progesterone as well to balance that out and prevent the risk of endometrial cancer. Also helpful for bone health. Testosterone and DHEA, again, if we've been under stress, we're pulling everything over to that side of the pathway and depleting the right side where the DHEA and testosterone. Those ones are not available to me or other NDs because they're considered anabolic. They're federally regulated. An exception to that is a DHA ovule that is used vaginally to strengthen vaginal tissue in women who can't use estrogen. Oh, nope, I put that in the wrong spot. Sorry. Estrogen potential benefits. It is approved for use in treating hot flashes and night sweats, even if a woman is still menstruating. This is Health Canada, Canadian Menopause website. You can talk to your doctor. I mean, they might still have some walls up. A lot of patients will come, their doctor said, well, you're still cycling, so I can't put you on MHT, but I can put you on the pill. That is still a hormone therapy. It's just an oral estrogen, which comes with more side effects and risks. Estrogen can also be used locally for vaginal atrophy or discomfort. So we call it the genitourinary symptoms of menopause. So the increased risk of UTIs, pain or tearing or any sort of discomfort with sexual intercourse. Could be helpful for heart and bone health in women. Potential risks, it does or can increase the risk of clots, strokes, heart disease, some cancers. So it's not for everyone. We're going to get that personal health history. We're going to look at everything that's going on in their life, their families. The topical form is typically less dangerous than oral. So classically, MHT these days is oral progesterone, topical estrogen in a patch or a gel. Side effects, some can be serious, some are common, some are uncomfortable. Conversation to be had with the prescribing physician. Now I'm going to go out. Yes, there we go. Sorry, put that out of order. So action items, really want you guys to just be the ambassador for your health, have the knowledge. I will, now that I'm hearing how many people on this call are having a hard time getting what they want or need from their medical doctors, I'll try to find the resources. We are all used to be Dr. Google. We are all now very familiar with Dr. ChatGPT. So you're going on like, but it says here that I can, and these are the doses you should be prescribing. Then maybe that conversation could go the direction that you want it to. We'll see. Ask questions, fact check. I had a woman in yesterday who's like, I don't know. My sister's telling me this. My friends are telling me that. The internet is telling me something. I don't know what I should be doing. I'm nervous, so I'm just not going to do anything, but I'm uncomfortable. So then we can go through, what are the risks and benefits to this individual, and what decision are we going to make? Chat with your primary care physician about any uncomfortable symptoms, see what we can do, and ask for routine blood work every 1 to 2 years to monitor metabolic changes. Heart disease is the biggest risk factor. Estrogen could be part of that treatment, but we also need to be looking at your insulin, your cholesterol, your sugars, overall health. So take-home message. These are not diseases. They have a disease code. These are not diseases. They are just transitions. We are just evolving into rose hips. Self-care takes on new importance as we are aging into our next chapter. So that stress management piece, the exercise, it's going to change from what we've been doing in our 20s and 30s. Body, mind, and soul still flourish the best when rooted in healthy foundations. So good food, Lynae's going to take us through that one. Regular movement, Sally's going to take us through that one. Mental health practices, sleep for Sally, journaling, laughter, connection, stimulation, keep that brain going, keep the life drive moving forward. And then specific nutrients, herbs, and prescriptions can be helpful, but they work best when they're tailored to that individual. There's no carte blanche, cookie cutter approach. Any questions? Here you can, again, take a screenshot if you're interested, follow up with me. And again, I'm going to try to find you guys those resources so that you can have a more encouraging conversation with your primary care physician about what you need at this time. And now I am going to stop sharing and pass the floor over to Lynae.
Brilliant. Thank you so much, Miranda. That was just so helpful. We have a couple of questions, but we're going to look at that at the end of this. I'm just going to remove the spotlight from you and put the spotlight on Lynae. And over to you, Lynae.
Can you hear me okay?
Yep, we can.
Perfect. This is a great transition after Miranda finished. So this is perfect. So welcome to the summit. I am Lynae Schimenauer. I'm just hang on here. It's going too quick. So a little bit about myself. I'm a natural nutrition clinical practitioner, a certified holistic nutritionist, counselor, as well as a mindset and leadership coach. And just to tell you a little bit about myself, I'm 27 years in the policing career. We'll be transitioning out of that next year. I've owned my business for the last 3 years, and I've been studying nutrition for about 8 years prior to opening up my business. So just a little bit about my philosophy is build for impact. You'll see here, build strength in times of need. So resilience is there. It really comes back to in 2018, I almost passed away from a medical procedure that went a little bit wrong. And I want to talk about my passion with women's health because of my journey. In itself is I have one daughter who's my pride and joy. And after her, I couldn't have any more children. And I had a hysterectomy when I was 40. So I'm the one that falls into that range of not having a uterus and not really knowing when life's going to kind of hit me with the perimenopause and menopause because I've had no menstrual cycle for several years already. And I'll be 54 this year. So very passionate about proactive health. And it's super, super important, especially in midlife, because this is a huge transition where we really need to take a look at our nutrition. I love health and wellness, just like Miranda. I'm a student of it. I'm always in the books, always researching, always keeping up with the latest information. I have one daughter, like I mentioned, 21, and I'm still working as a police officer and full-time holistic nutritionist as well. So I'm very busy. So it's good busy though. So, and I love it. I'm going to move us out of my screen here so I can work through. There we go. So nutrition in midlife is critical. And as Miranda was saying, which I love the transition, it is super critical here for all the reasons she mentioned: the hormones, the heart health, the metabolic health, the inflammation. It is crucial. And nutrition has a huge impact on that. One of the studies that I've researched even look at even 45 to up to 80% of nutrition impact how we age healthily going forward. So it is very impactful. So it's crucial with respect to the building blocks. It signals, regulates hormone production, detoxification, balance within our system. We're going to talk about sugar and inflammation and gut health, and it all comes full circle when we start talking nutrition and really keeping that balance that Miranda spoke about so well in her slideshows. So when we talk about why it's important, we talk about midlife, and its critical importance more than ever is because of those hormonal shifts. Like Miranda spoke about, all those hormonal shifts and everything going in our body midlife, it really puts a stress and emphasis on our blood sugar, inflammation, that cortisol balance that she spoke about, our bone density, muscle preservation, and all of that. It is crucial that this is a period of time in our life that we really almost just monitor what we're doing, take study if there's changes that we can be made, because any even small changes can really have a huge impact on how we age. So I love looking at this part of our age is just like a refocus. And often with our changes in our body, it kind of forces us to do that recheck in. So I always think of food as a good analogy is just information for your body. It's going to support balance or it's going to drive imbalance. And that's really a crucial and important way to look at it. So Miranda spoke a lot about these symptoms, but again, nutrition is really key. So if you're feeling, just always tired, no matter how well you've slept, or you're just feeling almost like that wired feeling, like anxiousness, panicky, you might be seeing difference of weight gain, changes in your body composition, which is usually around your midsection. You're having different food cravings, or you're having crashes midday, even into the late afternoon. Your sleep obviously is off, changes in mood, and even resilience about how you deal with stress. I hear often, I used to deal with things so, well, and I'm just all over the map. Where things never bothered me, they're bothering me. I'm just not managing things as well. Brain fog is a huge concern for women in midlife, and they're often, saying, am I having early Alzheimer's? What is going on? I walk into a room and I don't even know what I came in for, or mid-sentence, I can't remember what I was even saying. So that is very normal in midlife. A lot of women complain of joint pain and just soreness, aches that they've never felt before. These all have to come into, again, the change of our systems and the hormonal balances going up and down, like Miranda mentioned. Digestive issues is a huge one here, and then skin changes as well. Again, all with respect to those hormone changes. Oops. So why those hormones matter. Miranda spoke about this. They're literally chemical messengers that do everything in our body. And I find some women just think hormones are just what Miranda spoke about with respect to progesterone and estrogen and testosterone. But there's so many hormones in our body, insulin, cortisone, and they truly are messengers that rule everything with respect to energy, metabolism, hunger, sleep, that mood, that fat storage, which is what women talk about midlife. And then again, that stress resilience, that mental clarity and sleep. So they truly have a ruling of so much within our body. Today, we're going to emphasize on 5 pillars of nutrition, which are super critical for midlife. Blood sugar stability, protein and muscle preservation, inflammation, our gut health, and micronutrient sufficiency. So what's really critical in midlife is that if we look at these 5 pillars, they really will impact overall our prevention of chronic disease, balance of hormones. It will really help with respect to all of the symptoms that we're talking about. And because of our insulin instability around this midlife, it's super, super crucial with nutrients that we're taking in. Again, that muscle preservation. We lose muscle, and Sally is going to talk about this at quite an alarming rate come midlife. So again, we really want to preserve bone and our muscle health the best we can, so that, like Miranda said, we are picking up our groceries, we're able to get in and out of the car, in and out of the bathtub for many, many years to come. And it really comes down to just vitality and overall well-being many, many years post this stage of our life. So pillar 1, blood sugar stability. So why it matters is, obviously, I really like to give the analogy with blood sugar stability as the peaks and valleys. And really, as soon as you get up in the morning, if you are peaking your blood sugar quite high and you're doing the peaks and valleys all day long, it is taking significant stress on your body. And it will actually create that cortisol level that Miranda spoke about and keep it elevated throughout the day. And we really want to take a look at, obviously, if we have high insulin, that blood sugar is creeped up all day long, and we're at that elevated state, it's going to have an impact on how we store fat. Now, we spoke about the unstable blood sugar. It really puts significant stress on our body. This is pivotal when we're talking about metabolic health. And again, if you have those spikes, you're going to have the crashes, and you're also going to have cravings. If your body is used to that high sugar content, you're going to have the cravings. And often when I have clients that eating a lot of sugar, we almost do a little bit of a detox, and they almost feel fluish, lethargic, achy when they're coming off that sugar. And then when they come out of that, they feel better than they ever have before. But there's a little bit of a getting through that initial phase to feel better. And sugar, I have to say, this is, I really need to highlight, obviously, sugar, because it really, really impacts our body in such a negative way. And we're going to talk about inflammation and gut health. It's a disruptor of so many systems in our body. So it's really, really crucial. So how do we stabilize blood sugar? Well, nutrients. It's super important what we're eating and what we're focusing on, as well as the time of day and what we're eating as soon as we get up in the morning before we go to bed, again, to stabilize the blood sugar. We talk about fiber a lot, and I think, most people, it's really highlighted now with social media how important fiber is more than ever. But we really want to focus in on fiber. And why? Because it keeps us fuller for longer, but it also keeps that blood sugar stable. We want to aim for around 25 to 35 grams per day. And you can get them in, obviously, all sorts of food. Your fruits and vegetables, your legumes, your nuts, seeds, beans are great. Prioritize protein. Protein and healthy fats are pivotal for blood sugar regulation. So I just want to do the analogy that if, say, for example, you have waffles first thing in the morning, your blood sugar is going to significantly increase and elevate. If you pair it with a protein and a healthy fat, it actually stabilizes the blood sugar quite down, and quite alarming. And I've had a few clients on continual glucose monitoring, and they almost like test this out a little bit. They're quite alarmed by what protein and healthy fats can do with the pairing of just, normal food that they might eat that would have elevated their blood sugar. And then we'll talk about protein, of course, with muscle preservation as well. I talk about a balanced plate, and that again being your complex carbs along with your proteins and healthy fats. It's really crucial. And again, I want to mention here the portion size, because a lot of people, when I'm looking at what they're eating, it comes down to really slowing down what you're eating, taking the time to really be in tune with your body with respect to, am I still full, or do I give it some time? And what does my plate look like? Do I have a lot of carbs compared to the proteins and healthy fats? So I talk a lot about macronutrient portions when we talk about balanced plate. Of course, limiting refined simple sugars is the number one and easiest thing to do. Is we really want to look at how many grams of sugar are you getting in a day. And I would say the average are, and not even really known with all the hidden sugars in most foods, most people are getting at least 3-4 times the amount of sugar in a day that they should be getting. Sometimes in one Starbucks drink, they're maxing out their, completely daily allowance. So that is something to look at. Again, another way to stabilize blood sugar is lifestyle. Regular exercise and hydration is crucial when it comes to blood sugar regulation. And I wanted to mention those, even though it's not nutrition, it's super, super critical. Pillar 2, our protein. Really want to emphasize this. I know it's the rage out there. Everyone's like protein, protein, protein. And it's just like, it's everywhere right now, but it truly is a non-negotiable. I have to say for myself, back in the day, it was like protein was almost like the last thing I thought about. Protein is now the first thing I think about. And it preserves our lean muscle. It is crucial. We need the amino acids from protein. It's crucial for so many chemical messaging that's going on in our body. It's crucial, crucial, crucial. It boosts metabolism. And why that is because if we have more lean muscle on our body compared to fat, we actually are burning more just even sitting compared to our body not having the lean muscle. So even that in itself, it boosts metabolism. As a 150 pound woman with more lean muscle mass on her body, at rest, she's burning more calories. It reduces cravings. Why? Because protein and healthy fats really help you feel fuller for longer, and the blood sugar stabilized, which is a direct correlation to those cravings. And it really supports thyroid and I mentioned blood sugar. And so how much protein? I get this asked a lot. There's a lot of different ranges out there. Some people will hear 0.8, some people will hear 1, some people will hear 2. I like to say around 1.2 to 1.6 grams per kg. And this is in order to maintain and keep that muscle preservation. So, that's a calculation that can kind of vary a little bit. And some people, if they're not used to having much protein in their diet, they're quite alarmed by this. So we start slow and kind of build up, because if you're not used to a lot of protein, your body can kind of be like, what is going on here? So we'll creep it up slowly. So protein, what types of protein? You want to think clean protein. So clean protein, what I always refer to is eggs, egg whites, your poultry, even your nuts, your seeds, your legumes, cottage cheese, Greek yogurt, tofu, and then there's tons of vegan and great alternatives as well. And if I have somebody on a vegan diet or more sensitive to a lot of the different, or even dairy, for example, we really need to really key in on if they're getting a full protein here. So that is super critical, especially with vegans. A lot of times they're eating and they're not getting a complete protein, but there's a great way to do that. And it just needs special attention, but you can absolutely get the amount of protein in with a vegan diet. So I'm very cautious of time because Sally has a great time. So pillar 3, inflammation. So inflammation, I really want to key in on this because inflammation is a direct correlation to so many chronic diseases. And we need to be alive to inflammation in our body. And I think a lot of people, just like cortisol or inflammation, people instantly think, oh, it's all bad, but it is not all bad. Inflammation is what we need in our body to get rid of infection or if we have an injury, and that is okay. But what is not is always that increased inflammation within our body is what we want to stick away from and stay away from. It can be from having chronic stress. Now, again, Miranda mentioned with respect to chronic stress, there's so many things we can do with respect to lifestyle strategies to help negate that. But again, inflammation in our body, chronic stress with respect to nutrition. If we are under eating as women and over exercising, that in itself can create chronic stress in our body and increase inflammation in our body. So I want to highlight that because a lot of clients I see are really under eating and they're just, because they're not seeing the results that they want, they're not eating enough and they're exercising excessively and they're actually increasing inflammation in their body. Ultra processed foods are, I would say limit them altogether if you can. They are huge inflammatory markers. Poor sleep is another increase of inflammation in our body, and we spoke about that in Miranda's slide. And again, those blood sugar swings, the highs and lows, really put a lot of stress on our body, and that's going to increase our inflammation. It interferes with hormone signaling. I really like the analogy I like to give with inflammation is you really want to have a free-flowing system throughout your entire body. You really want everything moving well, your lymphatic system, your immune system well, your metabolic. If you have a lot of inflammation in your body, I almost feel like, I know when I have inflammation in my body, you almost feel sluggish and things are just not able to move as freely. And I love that analogy with inflammation because I'm such a picture type of person. So I like to give that one out. So anti-inflammatory basics with food. You really want to strive for whole nutrient dense foods. And when we talk about nutrient dense foods, what that is foods that are full of nutrients in themselves. They're not empty calories. They are packed with tons of micronutrients. They might even be lower in calories, but they're very high in nutrient dense foods. So anything like your nuts and your seeds, all your fruits, your vegetables, your great proteins, your antioxidants are crucial here. They are the antioxidant foods have a direct correlation to the inflammatory, the increase of inflammation in your body. Omega-3s, that of course is your salmon, your healthy fats, your olive oils, your avocados, and again, your fiber is crucial here. Another piece to anti-inflammatory basics we really want to talk about is your limiting and removing certain foods from your body. We already spoke about ultra-processed foods, but any high sugary drinks is crucial. High the trans fats, proteins with a lot of fat, and even the processed foods have a lot of trans fats in them. A lot of shelf processed foods have a lot of trans fats as well. And so again, when it comes to carbs, any refined carbs. So those are carbs that are easily to break down. There's not a lot of nutrients in them. We want to stay away from those. Another thing that's not on the slide is inflammation. Is also certain environmental factors can have inflammatory effects on our body as well. So that's another piece that we want to look at. Pillar 4 is our gut health, and why does it have a direct correlation to hormones? Well, our gut health regulates hormones within our gut. It also regulates our blood sugar. It impacts inflammation. And then the gut-brain axis is huge. So I always think of the gut, you have your brain, but gut is often referred to as your second brain. And it's really, really crucial because what's going on in the gut affects the brain. What's going on in the brain affects the gut. And I think anybody can, relate to this, that if they are stressed in their life, or they're going through, just a period of time that things feel just off with even hormones, or they've had, a meal really high in sugar or refined carbs, and they have that bloating and that gassy and that upset of stomach. It really is crucial to listen to what is going on in your gut. And I know, and I'm sure Miranda can speak to this, a lot of people coming into her clinic with gut health is what is happening. Everything going on in the body is going to have a direct correlation to that gut. So often, if we look at what's going on in the gut and improving that gut microbiome and that balance, we can really start to have an impact on a lot of other things in our body, which is really neat to see when you start zooming in on people's gut health. So gut support, we want to again focus on that fiber. Fermented foods, your pre and probiotics are crucial here. So your things like sauerkraut, your kimchi, your miso, those are really crucial. They feed the good microbiome. We want to look at your prebiotic foods, are the foods kind of like the garlics, the gingers, cinnamon, even all those spices and herbs are just fantastic here. They add so much nutrients to our food and really help the good microbiome in our gut. Again, we want to make sure that we're getting that good quality protein and the healthy fats. And again, keeping blood or sugar out of the gut the best that we can really help support the balance of a healthy gut. Now, there's so many nutrients with respect to really impacting our microbiome, but a crucial piece as well is our stress regulation, our sleep, and hydration. And these are key pieces. When I look at some clients with gut issues, I will ask them. I will never not talk about stress and what's going on in their life at the time, again, because of the brain and gut axis. And how much are they sleeping? Because again, if they're not sleeping well, it's direct having correlation to inflammation and cortisone, and it's going to affect the gut. Hydration is pivotal here. Obviously hydration, it's kind of common if we're not getting enough water and hydration in our system, we're not going to have the regularity of bowel movements and things like that. But hydration is super important as well for potassium, sodium, magnesium, the electrolytes, and again, the currents going through our body. Hydration, it's pivotal for our body that we're drinking enough water. Again, even for inflammation or a joint and joint pain, it's crucial. I'll often ask, how much water are we getting? And most people are not drinking enough water. Again, avoid the sugars and the ultra processed foods. They will have a direct correlation to gut health. It really offsets everything. And you'll hear kind of the leaky gut, and what that is parts of your gut are going into your system that you shouldn't be having. And we really want to stay away from that if that ever starts taking place. Your pillar 5 is your micronutrient sufficiency. This is super, super important, especially in midlife, because this is a time where often our micronutrients, and these are all your vitamins and minerals, and they are crucial for every single system in your body. Now, with midlife, just because we talked about the inflammation, metabolic health, the hormones, a lot of the times our micronutrient absorption starts to decrease in our midlife. So we want to take a look at that. We want to take a look at how it's supporting bone health, and are we getting the micronutrients that are required for that? It's super crucial. Your vitamin D, your K, your omegas, your muscle mass and strength. If we're not getting the micronutrients, I want to really focus in on this, because a lot of macronutrient is really where a lot of focus is. Well, how much carbs and protein and fats am I getting in? But the micronutrients, I always look at those. Those are the, the smaller, micro meaning smaller, and we don't need as much as them. They're micronutrients. And the quality and the amount that we need aren't a lot, but they are crucial for our overall health, and as well as enzymes. So supports metabolism and energy production. It's super critical for brain health and cognition. It strengthens immune system. It's a huge pivotal piece when we talk about chronic diseases and hormonal health. I would say most, and Miranda can maybe speak to this at the end, most Canadians are vitamin D deficient, and most people may supplement with that already. Vitamin K, your omega-3s, obviously your your Ds for your bone health, your calcium. And there's, Miranda, when she reads the labs and gets a really good idea of what your blood work looks like and some of those micronutrients, they can really have a key piece on it. And even a small insufficiency in a micronutrient can have impacts on how you're feeling overall. So your food sources, with respect to that, I always want to say, you want to look at going to food sources first and then supplementing. But there's a lot of reasons why we can't get enough of these micronutrients in our food sources. And it could be medications, it could be a medical condition, it could just because we have allergies or we can't eat enough of a certain food. So we want to look at our diet first, and if we can't get it all in our diet, then we start to supplement. So that is always kind of my key thing. And supplement is just exactly that. It supplements our diet. So we want to look at that whole foods, nutrient dense foods. Everyone knows this, but you want to shop around the outside of the grocery store. That's really the majority of your food is going to be there. And include your fruit and vegetables every meal. Every fruit and vegetables have different micronutrients in them. So this is where diversity is really, really important. If you're eating the same fruit and vegetable all the time, you're not getting that diversity of the micronutrients. So I think colors and think variety. So even if you're at the grocery store next and you're like, what is that? How do you make it? I don't even know what that is. Grab it anyway and figure it out, because your body's going to love it. And get creative here. So I always go to the grocery store and I literally try to make my cart look as colorful as I can. It's like a little obsession thing I have going on with like making like new creative ideas in different foods, but your body will be super, super happy if you do that. Whole grains instead of refined grains. Obviously, refined grains have no nutrients in them at all. You are going to get so much more nutrients out of the whole grains. Nuts and seeds and healthy fats are just packed with micronutrients. So healthy fats really emphasize on that. Again, if you aren't getting enough calcium and vitamin D, looking for fortified foods, and then the really rich foods that have those. Again, a lot of people start to supplement here, which is totally fine, because we really want to preserve your bone health, and it's really, really crucial. And again, proteins from diverse sources. So not, I have a lot of clients who just eat chicken and that's all they eat. We don't want to, really focus in on one thing. Again, we want to have that diversity, because every type of different food, whole nutrient dense food, is going to give us a different micronutrient, which is really important. So diversity is key. So the good news is, ladies, supporting healthy aging, we really, really can do it through balanced nutrition. And I love that, because it's one piece that we can change instantly right out of the gates, and fairly easily to do. And with a little bit of interest and a little bit of curiosity, it can change our outcomes significantly as we age. And what our goal is really going forward in life is to build strength and resilience and vitality. So there is where you can contact me, but I won't take up any more time, because we're going to go into Sally, and then you know where to find us all. So thank you so much. And I'll turn it over to Sally, and she is going to talk about how she stays so peak in the gym and how important it is.
Thank you, Lynae. All right. Thank you so much, everybody. I'm very mindful of time. If you have any questions, please pop them in the chat. And I know a couple of people have to leave right on 11:30, and we will get to that in a minute. I'm just trying to, just a sec. Spotlight. There we go. Okay. So I'm going to talk about my favorite topic, exercise. I have been in the health and fitness era for 43 years. I began my career in Edmonton back in 1981, 82 as a fitness instructor. We owned a number of gyms there. I hosted the first Canadian cable TV show in Edmonton. There was Jane Fonda on one station and there was me on the other. We know how that turned out. Anywho, that was, and then I also was the host for the world's largest indoor aerobic class that opened up the Edmonton Convention Centre in 1983. We moved to Australia, had our 3 children. My husband's from Saskatchewan originally. And then I continued on the fitness industry for another 15 years following that. My son was diagnosed with ASD in 1997. 98, and I stepped out of the industry for a period of time to care for him. And those are the days you got no money for funding and you had to do everything by yourself. So it became impossible for me to stay in the fitness industry. And so I wrote a book about our journey, and ended up working in the area of autism for a number of years, until he came and said to me one day, "Can you stop talking about it, please?" Okay. And so then it was a deal I'd made with him when I wrote my book, that whenever he got uncomfortable with talking about autism and him being in the spotlight, I would step out. I had to honor that. So I worked in education for 10 years as Director of Marketing Community Relations for a large independent school on the Gold Coast in Queensland, and then got sick of that, launched my book, and then became a midlife women's wellness coach. I went back to what my passion was. I'm also an EFT master trainer and a professional counsellor. I just released my 3rd book, Strong, Clear and Unapologetic. I'm a little bit older than most of you on this call. I'm actually in my 70th year. I can't believe I'm even saying that. 70, for God's sake, is that even a number? But what I love is that I have more energy, more vitality, more focus, more joy in life now as I'm going into this next stage of my life. And I think midlife has shifted anyway. I think midlife now encompasses from about 50 to about 75, because I'm seeing more women my age actually living extraordinary lives. And it all comes down to exactly what Miranda was talking about, the knowledge about what you go through. what Lynae was talking about nutrition, it's so critically important that we become the caretakers of our own bodies. Back in the day when I was going through perimenopause, no one talked about it. No one knew it was. In fact, my doctor kind of scoffed at me when I suggested maybe I'm in perimenopause. This was in 2004. And he said, there's no such thing. It's not a thing, is it? And I was left by myself. And I thought, I'm actually either dying of some dreadful disease or I'm going to end up, suffering Alzheimer's or dementia. So I began a journey of finding what worked for me. I had the background in fitness and health. I had a background in EFT and tapping and counseling. I knew the power of brain, understanding your own mental health, and releasing emotional challenges that for you. And so I created what I call the 10 principles of wellness. And that's exactly what I'm going to share with you now. And we're only going to do 2 today. Let me just get my slides up. So the 10 principles of wellness was, what happened to my, wait a minute, let me go, try again, share. There it is. There we go. The 10 principles of wellness, and they are, sorry. There we go. Eat intuitively, fast intermittently. I'm just going to quickly go through these. Exercise effectively, sleep soundly, which I'm going to work on these 2. I'm going to share these 2 today. Process emotion consciously. Honor your personality, very important aspect of understanding who you are, and that we all have come to this world with different personalities. Live purposely. What does that look like when you're in midlife? And many of you on this call, I can tell, are actually beginning to live your life purposefully, and you're finding that passion. Is so important. Speak powerfully, learning to understand who you are and speak your truth. Leading authentically, so powerful now. Man, we need more women to lead authentically, because there's a lot of big, white men with their fingers on a button at the moment, a big red one. And embrace change joyfully, because that's what this is all about. This is embracing change joyfully. Because this is your time. You're not broken, as Miranda was talking about and Lynae was talking about. We're not broken. We're going through this time, and our body is asking for alignment, not punishment. And the principles of the roadmap for the next chapter. And what I'm going to focus on is this one. Your body is asking for alignment, not punishment. I came from the era of more is better. Calories in, calories out. I'd spend hours. In fact, I used to teach 4 aerobic classes a day, and then I'd go for a 6K run because, I'm burning up all those calories. Really funny. It doesn't work. Did when I was 20. Doesn't work when you're 50. So I'm focusing really on the 6 aspects of what I call exercise effectively that have to work in conjunction with your nutrition and your knowledge about your hormones. Your strength, muscle mass, is your longevity powerhouse. We've for too long, and I still see it today. I see women on the treadmills in the gym just pounding it out. That doesn't work. If you spend an hour on a treadmill sweating, you'll have burnt off about the equivalent of a slice of bread in calories. It's just not where it is anymore. What we need to focus on is muscle mass. And because we lose about 30% muscle mass from the age we're about 40, and it continues on to 2 to 3% per year. So the second leading cause of death in women behind cardiovascular disease is frailty. And frailty is because you just don't have the strength anymore. I don't know how many people, you may know this on the call today, how many women that fall and break a hip and never recover. That's the power of when we have our muscle mass is no longer there and our bone density is impacted. Something like a broken hip can really impact on your longevity. But the other part about strength, working with muscle, so focusing on muscle, I always say to my clients, think muscle first. Think muscle first. Number one, the more muscle you have, the higher your metabolism, so you'll burn more calories anyway. But the myokines and glutamine, which exist in the muscles, is your immunity powerhouse. So that helps you build your immunity. The stronger you are, the better it is for you. Now, I want to also address a topic here. Women will not bulk up. as Miranda was talking about with testosterone, we don't have enough testosterone in our bodies to bulk. But I got to tell you, what I love to see now is women with defined arms and strong defined legs. And it's that shift away from skinny, although we're seeing that a lot at the moment with GLP, is we're seeing a lot of these kind of, Hollywood celebrities going back to super skinny. That's just so detrimental to their health. You want to think all the time, how do I get stronger? How can I, walk up a flight of stairs with 2 heavy bags of groceries in my arms without, feeling like I'm going to fall over? How am I going to get my children and grandchildren out of the car seat and put them down on the ground? That's what strength is for. I have a granddaughter at the moment, and my husband and I are both up and down on the floor with her as she's learning to roll over. And I was thinking the other day, I'm so grateful that I have at my age the energy and the strength to get up and down off the floor with her and while holding her. It's just such a boost of confidence. The second aspect of principle number 3 in exercising effectively, which is the 10 principle in wellness, the 10,000 step myth. It's a myth. 10,000 steps a day was a marketing exercise back in the late 70s when a Japanese company developed the pedometer. And if you don't remember what the pedometer was, it was that thing you tied to your shoelace and counted your steps. And they claimed to try and get to 10,000 steps. There is no data that shows 10,000 steps is good for you. A recent study in Australia from a Sydney university found 7,000 steps is about normal. And 7,000 steps done over the day, not all at once. So you might want to go for like a 20-minute walk in the morning, get 3,000 steps up. You might want to do some movement in the middle of the day and get some steps up. And, even a walk after work, or you might do a workout at the gym, is all going to help you get those extra 7,000 steps. And we talk about the benefits of what we call exercise snacks. And that is regular movement during the day. Because what we're doing is we are sitting way too much. Our bodies were not designed to sit like this. It wasn't. I remember my grandmother in her 50s chopping wood. I don't remember her ever sitting for long periods of time until she got older. She was always up and doing something. We don't even roll the window down on the car anymore. We push a button. We push a button to open the garage door. We push a button to change the TV station. We don't get up and move anymore. So regular exercise snacks would be something like every 30 to 60 minutes is getting up and going for a walk, even if it's just to make a cup of coffee, even if it's just to hang the washing out on the line. Those regular exercise snacks, or one of my favorite things to do is just 10 power squats. Just stand up off your chair and just do 10 power squats. It's enough to just really help with your reducing blood sugar and also increasing your energy. And there's the energy surge of what I call the power squat. And that's what, as I said, if you just get up off your chair and just do a squat down into your chair, your glutes, gluteus maximus, your bum, and the quadriceps in the front of your legs are powerhouses. And as women age, that's where we need to focus on, to build metabolism, but also strength. When you have strength in your legs and the lower body, it allows you to do a lot of the heavy lifting without having to rely on the body. The third aspect, exercise effectively, is posture. And I all know you just sat up. Posture is so critical. If you walk down the street, just look at people's posture. Nothing ages you more than poor posture. And if you stand up straight, shoulders back, hips slightly tucked under, you look like you just lost 5 pounds. Posture is extremely important for us because it reverses the impact of sitting, because if we're sitting at our desk scrunched over instead of lifting up, you automatically feel that abdominals engage if you're sitting up and your kind of hips tucked under. So you don't really need to do abdominal work. You can just do that, and that's engaging that the abdominals, and that will help you feel stronger in that area, and also allows the chi energy to flow. The chi energy the Chinese talk about starts from the head, goes down to the bottom of the feet. When you're in alignment and you have good posture, what that allows that to do is that beautiful chi energy to just flow. The fourth is form. Our body is designed to move properly. If you're doing any exercise, you want to focus on your form. I really encourage people to do exercise in front of a mirror so they can see their form. And, last week, for those of you who follow me on social media, you may have seen that I had a back spasm. And it happened because I was in the gym and I'd lifted up some really heavy weights. And for a moment, I wasn't paying attention. I let the weight drop. And as I let it drop, my back went into spasm. It was incredibly painful. I've done it before by just pulling socks out of the dryer, too, by the way. But this happened for this one. But what I love is because my body is strong, I know how to stretch it. I know what to do with it. Within 5 days, I was fine. And in 7 days, I was back at the gym, because it's really not what happens to you. It's how you recover that's exceptionally important. Form always begins with the abdominals. You want to think of hips tucked under. You're lifting up that length between the chest and the hips. And you want to think about lifting up whenever you're doing an exercise. So your form, think about a ballerina. If you watch ballerinas, the way they move, that their whole body moves as if it's one. That's what you want to be doing when you're working with your form, not standing on your toes, but you want to think in terms of shoulders back, hips tucked under. And I'm engaging my abdominals when I'm doing this exercise to protect your lower back. The fifth is flexibility. So important as we age, because it improves mobility, reduces the risk of injury, and improves blood flow to muscles and joints. You should be getting up and doing some stretching, probably every couple of hours, whatever you're sitting. Just stand up, put your hands up against the desk, put your leg behind you, and just lower that heel to the ground to get a good stretch in those muscles at the back of your legs. You may want to do some arms out and then pulling your arms behind, so you get a good stretch across the lower back and you get a good stretch through the chest. And it just improves the blood flow. And balance is key to injury prevention. I had a friend of mine just recently who fell, same age as me, who fell. She was walking into her house and slipped on something on the path and fractured her wrist. And she reached out to me and said, I have to work on my balance. She said, this fall has taken away my confidence. And that's what happens. So your balance is really important to work on, because it helps build that confidence. Honestly, since we've moved here, I've never seen footpaths so uneven as I have here in Vancouver. If you want to be able to walk down the street and if you trip on a tree root, the footpath is uneven, you want to be able to catch yourself instead of falling. That's what balance does. The proprioception new messages from the ankle to the brain helps protect you if you're going to fall, and gives you better cognitive function. Balance is really, really important. So just stand on one leg for 10 seconds while you're making a cup of coffee, then do it the other leg, and then try it with your eyes closed and see how that works. Right, that's exercise. We're going to move straight into sleep routine because I'm very conscious of time. So principle number 4 is sleep soundly. And honestly, I follow a Dr. Fat Loss researcher, Dr. Bill Campbell, and his latest research on women in midlife, he says, don't even attempt to lose weight. Don't even attempt to try and be fit and strong unless you're focusing on your sleep. Poor sleep significantly accelerates brain aging, raises the risk of cognitive decline, Alzheimer's disease, and cardiovascular events up to 75%. And I know for many women, sleep in midlife is an issue. So there's 2 critical deterrents to quality sleep. 1 is alcohol. 2 is sugar. And for most women, let me know if you're one of these people, glass of wine at night, and then you might have maybe some sweets, maybe chocolate, or you might have some ice cream, because it's cold and it's dark, and the dessert makes you feel a little bit better. But what happens is, when it comes to alcohol, is the body goes through a process called fat sparing. The body will process alcohol from the liver before it processes fat from your food. The second thing about alcohol is often it causes us to fall asleep, but then we'll wake up. We won't get that deep sleep. Alcohol won't get that deep sleep. And sugar when you eat sugar, as Lynae was talking about, when you eat sugar, you get the spike in blood sugar. So if you have, say, a piece of chocolate dessert around about 7 o'clock, 8 o'clock at night, you're going to blood sugar level rises, and then it drops. And guess what happens? That what elevates or tries to mitigate blood sugar is cortisol, trying to balance it. And that's usually 2 o'clock in the morning, 2 o'clock, 3 o'clock in the morning. So if you want to have alcohol, here's the thing: 1 glass of wine, 1 glass of water, 1 hour before bed. 2 glasses of wine, 2 glasses of water, 2 hours before bed. So I'm not a great believer in saying cut everything out. If you like your glass of red, or you like it, we tend to have white wine with soda water. Manage it. Don't eat before you go to bed. Don't have a glass of wine before you go to bed. Give yourself hours, a couple of hours for the body to process all that. And finally, adopt a sleep routine. If you want to be asleep by 10 o'clock at night, you want to start preparing for that at 9. So you want to have timing. So you want to turn off your phone at least an hour before you go to bed. You want to have the lights dim. You want a cool bedroom. Preferably, I prefer a silk pillowcase because it's cool. And you want to ensure that you're not taking in that blue light. Here in Vancouver in particular, because it's dark early, we tend to have all the bright lights on. So you want to be giving your body an initiative to wind down. If you want to get a good 8 hours sleep, if you want to be asleep by 10 and you want to get up at 6 in the morning, you need to be starting to get ready for bed at 9. Just a quick call before we finish. Miranda, Lynae, and I are creating an 8-week support and coaching program. So there's no second guessing yourself, and it's about the journey finding the real you. And we will be sending the details of that out. In the next little while. So I think I finished right on time. All right. So we're going to go straight into getting questions. The first one is
great questions.
Yeah. Miranda, your first question comes from
Nadia.
Nadia, yeah. So she talks about wild yam cream. Can you share a little bit about that, please?
Well, this is one of the other things that comes is if someone asks me a question, I tend to fire 10 back. So I need to know, like, what's the dose of the wild yam and what are we using it for? And have you noticed any benefits from it and all those things? Wild yam itself is the starting material by which the chemists in the lab make the progesterone. It does not itself contain progesterone, but it is, especially before hormones became widely accepted again, when we were still in that like hormones are scary decades, people were turning to wild yam. It's an antispasmodic. It has benefits. I typically dose it orally. So my question would be, how long have you been using it? Has it been helpful? I don't think there's a harm in it, but I don't think you're actually getting direct progesterone benefits from it unless they have modified it in some way. Was that the question, or do you have like more specific?
Yeah, no, I really do think it is. What's that word?
Placebo?
Placebo for me. So it's like I'm doing something, but I feel like I'm in 1970s and just like
Yeah, it
and
might
I'm
be.
not even
And placebos work. So
yes.
yes.
Yeah, but I actually don't strongly notice any change from it. But I know that it's out there as like an option. But it says on my label, use it twice a day, except for like 1 week out of a month. And it's like, I'm lucky if I remember it once a day,
That's asking a lot of us.
Yeah.
That's too much. That's like boxes on the calendar, and we've got kids and lives, and yes.
Yeah.
Yeah. So it's not going to do any harm. I'm just not convinced it's going to do any benefit either.
Yeah. Great. Thank you.
Awesome.
I think, Nadia, you asked the question also about alcohol.
Mm-hmm.
Was it you? Yeah. I think hopefully I answered that. I love my wine. So I'm going to hand up. I love my wine. I love my glass of wine at night. I love the ritual of it. Like 5 o'clock, glass of wine. My husband cooks dinner. I sit at the bench and we chat about the day. And I've done, 90 day and 6 months alcohol free. And to tell you the honest truth, it made no difference to me. So I think it's part of a balance. Like there's a lot of talk about the types of wine. My son-in-law is also CEO of the British Wine Growers Association, so there's always wine in our family. And I'm not going to sit there and be like, a friend of mine once said to me, if you dare give up wine, I'm not talking to you ever again. I think it's a balance. To me, it's a balance. And as I said, I like good Pinot Gris with some soda water, and that's how I balance it. It's if you have too much and if it's impacting on your sleep in particular, and also being mindful again of that fat sparing where the liver is processing. So if you want to get rid of that belly fat, if that's an issue for you, you want to lose weight, it's the burning fat's going to be the last thing your body does at night. So while alcohol, has been called a carcinogen, I think it's one of those things that's a balance. And not eating too much, not drinking too much. I think if I have more than 2 glasses of wine, I'm not sleeping.
Agreed. I think because we're trying to maximize quality of life, and if this is something that brings you joy, then we don't want to be like, no, you can't touch that anymore. You're going to live 30 years of misery and deprivation. That's not what we're going for. There'd be people like, maybe just have it with the meal rather than before the meal. Like again, it comes down to the very individual. If we want to minimize the impact of the blood sugar, having wine or alcohol on an empty stomach, you're going to see a higher spike. But if you're having it with your meal, then it can be social. And then that also kind of speaks to Alona's follow-up question about coffee. Again, it's a joy. It's delicious. I did go through a moment, it was COVID-y, so 5 years ago, of why am I taking herbs and nutrients to address my anxiety and then making myself a cup of coffee in the morning? So I started a slow process of I have like a Bialetti type stove top coffee maker, and it was like, I'm going to do 80% caffeine and 20% decaf. And then slowly those ratios changed. And now I'm mostly decaf. I still get the flavor in the morning. It still tastes delicious. I still have my ritual. If there's a poor night's sleep, I might throw in like a scoop of the caffeine. My husband likes the real stuff. And we kind of play with it. But again, we don't want deprivation. Choose organic. Get it, but like I think we're also at an age, like in my 20s, I put up with a lot more junky stuff, traveling in hostels. Like it was just, now I'm the patient, like, I want the good stuff. I will have less chocolate if I can have the best square rather than, oh, well, here's some, kids' Halloween candy and I'll just shove it in for the sake of it. It's like, that I can skip. I think keep the coffee. But if it is, if you're getting those crashes after, maybe just start exploring half calf, exploring 3/4 decaf and seeing where you go with that.
Thank you.
I think also we talked about balance, and I think the minute you get into deprivation, the minute you stop, enjoying life, that's when you're going to binge. I'm a great believer in what I call I allow. I teach intuitive eating, and I talk about I now allow myself instead of the restriction. The minute you say I'm going to allow myself to really enjoy this without guilt, you do. You'll have one, as Miranda said, get the best chocolate, have one piece. Because if you buy a real chocolate, because most of the stuff we have on the shelf is just sugar, and so the body's looking for the chocolate. That's what we're looking for. We keep eating more. A number of years ago, I met a food technician, and she was telling me about how they tweak food to make us want to eat more. So she was telling me the story of they developed a bag of corn chips, and they're called chili corn chips, but they only put chili on every 5th chip. So the idea was that people kept reaching in to get the chip. The same with chocolate. The chocolate you see in the supermarket is just sugar and yuck. But if you want good chocolate, the body will be satisfied with that. So, as I said, I probably the others, Miranda and Lynae, would agree. It's not the minute you deprive yourself, you're going to want it more.
The forbidden fruit.
Yeah. Iona, you had another question. Oh, sorry.
Sally, can I just add in one little comment about the alcohol and the coffee? It's funny because this comes up a lot in the conversation when I'm doing nutritional coaching as well. And a big piece to that is it's like what I used to be able to drink or my coffee is having different effects. Like I feel different on it. And, it seems to be coming up in midlife more and more that, I was able to drink a cup of coffee as soon as I got out of the bed, get on my way, have breakfast an hour and a half later. And it just isn't sitting with me right. Same with the alcohol. With the coffee, I try to urge people not to drink coffee the first thing in the morning. It took me a long time to get out of that. That was my loved coffee. Again, everyone is individual and you got to find what works best for you. But there's definitely not a downfall to not having coffee first thing in the morning. If you can start out with hydration and water first and maybe some protein and healthy fats and then your coffee, your body is going to be a little bit more stabilized because it is going to shoot up, again, depending on even what you're putting in your coffee too, right? And a lot of people fast and then they sometimes break with the coffee or what have you. So it all depends. Again, it's variable and you always, have 1,000 questions to ask when somebody asks the question. But I think it's really important, I think, to just put that out there specifically because that was one of the questions. And I urge people to try to hydrate first, proteins, healthy fats, and then your coffee. 1 to 2 cups seems to be about the healthy balance. Again, maybe going to a decaf and not having it too late in the day. And then again, with the alcohol, again, same thing. I'm not a drinker, but I know so many people, they're like, I love my glass of wine, and exactly the same. Like, you need balance. And when I'm setting up somebody's nutritional program or what it looks for longevity is you don't want completely to change someone's entire existence. You want to be realistic so that it sticks, because what you want to put in place is something realistic in someone's life that they're going to be able to maintain for the remainder, right? And whether that's just cutting it down in half or earlier in the day and with food. But I would always suggest and ask, get curious. How is your body reacting to it? Is it different over the time? Is it changing? That is a crucial piece to it. And obviously in terms of what type of alcohol too, because we know there's different effects to different type of alcohol, just like the chocolate, right? We want to look for cacao and 70% or 80%. That dark chocolate has actually got antioxidants in it, so there's little tweaks that we can do to sometimes, make it a healthier alternative. So anyway, that's
Great.
all I had to say about
Thanks, Lynae. And you had another question that I think is directed at Lynae.
Miranda.
Miranda.
The hormones?
Yeah.
Yes.
Yeah, the hormone therapy.
Yes.
When we are going through the list of who's high risk for estrogen therapy, who's medium risk, who's low risk, it's a personal history of breast cancer. So prior to the 1990s, from 1940 to the 2000s, there was no increased risk of breast cancer that was found. As increased risk of endometrial cancer from unopposed estrogens. When they did that big initiative study with the nurses, it was canceled in 2002. They stopped it early for fear of, because the data was showing increased risk of cardiovascular disease, increased risk of breast cancer. Now, revamping that and looking at the numbers, they were using the equine estrogen oral, so then we're getting a lot of the cardiovascular risks. They were using synthetic progestin, so we know that affects things too, and we're starting to tease out the progesterone. And then I had to look this up because numbers I can't remember. 70% of the women in that study were either overweight or obese. More than 50% of them were smokers, either past or present. Many of them had high blood pressure, and they excluded women who had hot flashes and night sweats because they didn't want them to get the placebo, not feel good, drop out of the study, and ruin their numbers. So they were looking at the average age of the woman was 63 years old. Most of them were 10 years postmenopausal. So it's when they're like, this is scary, it's bad, don't do it. And then the research was like, no, it wasn't that bad. It was. And the publication said that it was a non-significant, do I have the quote? I do not. But that the risk of breast cancer was considered statistically non-significant. But the researchers, the reporters kind of blocked over that not and kind of lumped it. So we look at personal breast cancer risk. We're looking at cardiovascular risk. We're looking at your bone scores. We're looking at your cholesterol levels. It becomes a very personalized thing. There are ways of going deeper into how you metabolize estrogen by looking at urine markers. There's the main estrogens that are in your system, E1, E2, E3. E1 gets broken down by the liver, And it can go down a pathway that is considered safe and protective. It can go down a different enzyme pathway that creates a metabolite that can cause DNA damage. So if we're concerned about breast cancer risk, we definitely want to make sure that that pathway is not overly active. And it can go down a third pathway that makes more kind of fertilizer-like estrogens, things that grow. So you end up with more endometriosis, sort of hyper-proliferative things.
Yeah.
So for the women, if we're really concerned, it's a private test and it's, not the cheapest, but it can give that peace of mind of like, okay, I am making 80% of the protective one. I am now more comfortable. And similar to that placebo effect of something might make you feel better, we also know that there's a nocebo effect. So I think if people are going like, I want to do hormones, but I'm scared of it, don't do it. There's a psychological, I'm not comfortable with this, and I think you'll metabolize it differently in like a bit more of maybe of a woo-woo space. But like if you're going to take on any sort of therapy, do it willingly and openly, and having asked all the questions and being comfortable that I think this is going to be the best thing for me, as opposed to like, am I doing myself harm?
Yeah.
Then we'll find the alternatives. There's great herbs. We were forced to use herbs and acupuncture for decades because hormones were so scary. So the breast cancer risk, not major. And nowadays, the risk of dying of breast cancer is 2.5%.
Mm-hmm.
So the bulk of cases, very treatable in the long run. Absolutely something we need to be mindful of and preventative with, but not as scary or dramatic as we had previously thought 20 years ago.
Great question, Naona. My mum was the same. Mum passed from breast cancer. They weren't even going to look at me.
Yeah.
Thank
you so much.
Yeah. No,
all right. Thank you that was a great question. Thank you so much.
Mm-hmm.
And I've got one more question here from Nadia. I always take the stairs. I know Nadia's dropped off at all.
Yeah, that's okay. I told her we'd send it to you.
I always take the stairs and live on the 4th floor to try and get those exercise snacks into my day, but wondering if I am leaning on that too much and doing any strain on my knees. Well, that's where quadriceps strength comes in. So that's what I was talking about during the squats, and we're doing lunges. You want to build that strength around your knees. So usually knee issues are often related to an old injury or something you've done in the past. Like you might have played sport in the past and you've wrecked your knees because of that. Also, that's the problem as we move into midlife, that the ligaments are not as strong as our estrogen declines. It also estrogen impacts on every aspect of the body, not just our uterus. And so ligament, you have to be very mindful of that. So if you're unsure about that, does it hurt when you're climbing the stairs? Do you feel, and interestingly enough, with stairs, it's actually the downward step on the stairs is actually worse for you than the stepping up. It's the down. So you just got to be mindful of your posture and your form. Are you leaning, pushing into that quadricep and your buttocks muscles, the gluteus maximus, rather than pushing forward on your knees, because often you'll overextend it and go over the top of your knee. But it's stairs are just so good. I do every second day I do HIT running up a hill. And I'm very mindful when I'm doing it of just my body being in total alignment all the time, because it's those injuries, I say, number one, because our estrogen declines, impacts and everything, but often it's poor form. And often if you played sport as a kid, we didn't have the stretching and the drinking water. I played what we call netball in Australia, which is a stupid game. And it's a physiotherapists love it because it's run, stop, pivot on one leg and throw the ball. Just every woman I know played netball when they were kids, all has knee and hip issues. But now we have much more understanding. So back then, a lot of the injuries we actually now feel happened in the past. So you want to be having, get a good osteopath or a good physio to make sure that they often give you exercises to do that strengthen that area. I hope that answered that question.
Do you have a comment on that, Lynae?
Oh yeah, I was gonna say, I love looking at exercises a little bit because I've had so many injuries and so many surgeries, and I found even recovery, like I say, nutrition diversity, but I think movement is really important in the terms of diversity too. Yep. So you're right. Climbing stairs is such a great way to build muscle, that impact and all of that. But with exercise, especially since I've gotten older, I really try to add diversity into my workouts.
Yeah.
So it's the strength training and the cardiovascular and the flexibility and the balance. And so I incorporate lots, like go for a walk or go for a hike and then do yoga and then go do like just, do a bunch of different things to really help overall your body and the different muscles and different benefits. That's it.
And I think with everything, as you were talking about both you, Miranda and Lynae, everything is knowledge. Like if you're doing something and it doesn't feel right, question it. Don't just ignore it. And I think to me, I teach intuitive eating, where you learn to trust in your body. And your body is always sending you messages. If you're getting out of bed and you're going, oh, gee, that hurts, what are you doing? Like, go see a physio, go see an osteopath, work with, or a physical therapist, and figure out if your back's sore when you're waking up in the morning, because that's normally when it happens, why? Are you sitting too much? Are you not getting enough stretching? If you're not, yoga's wonderful. Or
you need a new mattress, dude. Like,
you need a new mattress. I mean, I think a lot of, I remember when I was going through this terrible time, I did the whole thing, perimenopause, with a loss of, lots of bleeding, twice in for, iron infusions. And I remember the doctor who said there was no perimenopause, but anyhow, I remember him saying to me, why do women put up with this? Why do women put up with not questioning what's going on for their body? We've gotten so used to, and I grew up, my mum's post-war, you just got on with it. You didn't complain. You didn't ask questions. I mean, I did a podcast last week with a gal from Ireland, and she said in her grandmother's time, women were put into mental institutions and given electric shock therapy. It was called, perimenopause was called hysteria.
Do you know why? That's an old Greek thing. It comes from like hysterectomy. It's the uterus, and in the Greek theory, the uterus was moving around and it was affecting your brain.
Good.
And it's like, but before we started doing anatomy classes and like opening up bodies, like that uterus is making that woman act hysterical.
Yeah, right. And so we're not far past that generation, and our own mothers. I know my mother didn't talk about menopause at all. God bless her. We're a new generation now when we're allowed to say something's not right. I'm not going to accept that it's just a thing. Don't do that. We are knowledgeable, powerful. The more knowledge you have, the more intuitive you are. And then, as Miranda was talking about, Lynae was talking about, then you make decisions for you that are right for you, not for the person, not your best friend sitting next to you as 2 glasses of wine and she's going to tell you what she does. I can't tell you how many times women have told me a specific diet worked for her best friend's friend, so I should go on that too. No.
Is the same doctor who asked you why women put up with it the same one who dismissed your perimenopause?
Yep.
Well, that's intriguing.
Isn't
the other
it?
point I want to make, there's been an influx of, professional sports players having tendon issues and ligaments. And I think a lot of it is from nutritional changes over the years of like, we only eat chicken breasts. We only eat this, we only eat that. And that movement back to bone broth and saving every bit of it. I made tortilla soup this week and the leftovers went in a bowl. And when I pulled it out, like the bowl is solid. And I was actually like scraping and scooping. I cut it down the middle and warmed up half of it. And the other half is staying as a jelly. And that all becomes good nutrients for joints and ligaments. So getting back to whole food nutrition.
Yeah, the 1980s were all about low fat. I mean, I was teaching 4 aerobic classes a day, running 6 kilometers a day, and I would live on grilled chicken breast, take the skin off, steam broccoli, and that was it. Low fat, everything else. No wonder women now are struggling with their health and nutrition. No, we've got to get that, whole foods, lots of protein, lots of micronutrients.
As nature made it.
As nature made it. All right, we're going to wind it up now because it is 10 to 12.
Lovely.
Thank you for those who are still on.
Thank you so much.
Thank you, Lana. Thanks,
that
Riggs.
was amazing. Thank you.
Thank you for being on. And for those who are watching the replay, please, if you have any questions after this, just send us an email and either Miranda, Lynae, or myself will answer that email for you. And we will also be sending out a survey to ask you.
We want feedback.
yeah, what your feedback, what you'd like to see more of, and we intend to do some in-person events coming up towards the end of the year, and we'd love to have you involved. So can I again just thank my co-presenters, these amazing people, Dr. Miranda Wiley, Lynae Schemenauer, and myself. And our passion is women's health. Our passion is allowing women in midlife to feel the best they have ever felt. And can I tell you, for those of you in the middle of this, once you get through it, man, it's good. You just don't care what anybody thinks about you. And if you are strong and fit and healthy, this stage of your life, postmenopausal, will be the best 30 or 40 years of your life. We will all live to 100 because that's the way medicine's going. They'll keep you alive. But how do you want to live that
quality of life? Yeah.
You want to be 80 years old and sitting in the nursing home because you're so frail and eating, egg salad sandwiches, or do you want to be out creating the life you want? So blessings to everybody. Thank you for joining us.
Thanks, everyone.
We shall see you soon.
Have a beautiful day, you guys.
You too. Bye.